of new clusters, especially when the origin of the cluster or the driver of the cluster is not recognised, is always a concern. But what we do like to see is an immediate response to that and a comprehensive set of measures. In other parts of the world where we've seen that approach of really investigating thoroughly, testing, isolating and quarantining cases or quarantining contacts, it has generally led to containment of the clusters, be they around religious communities, around markets, around other migrant dormitories and many other environments in which this has occurred. However, Beijing is a large city and a very dynamic and connected city, so there's always a concern. And I think you can see that level of concern in the response of the Chinese authorities. So we are tracking that very closely. Our country office, and remember, we do have a team in China that's actually based in Beijing. Our country office there is led by our country representative, Dr. Gauden Galea, and we have a number of epidemiologists permanently embedded in our Chinese office and work on a day-to-day basis with colleagues at the National Health Commission, at the China CDC, and at CDCs all around China. We have offered further assistance and further support as it is needed, and we may be supplementing our country office team with more expertise in the coming days as the investigation develops, and are working directly with colleagues again at China CDC on some of the more important findings like genetic sequencing and other investigations that will be important to understand the origin and spread of this disease. Ria?
Yeah, I just want to highlight, not particularly on Beijing, but in all countries, that have had some success at suppressing transmission, have been able to reduce transmission to a low level or eliminate it. All countries need to remain at the ready. And so it's very important that countries have the systems in place to be able to quickly identify any suspect cases and test those cases and follow the same pattern of events that need to happen. Make sure we test, isolate, trace contacts, quarantine contacts, so that any resurgence can be picked up quickly and can be stamped out. And I think that's an important message. It relates to even the first question about where is the epicenter. In some respects, all countries need to be prepared to be that epicenter and to prevent the possibility of becoming the next place where cases can resurge. We know from the data from our seroprevalence studies that a large proportion of the population remains susceptible. So all countries need to be on alert, and Beijing has activated their systems. We've seen similar situations with Singapore, with Japan, with Germany, with many countries. And so it's just important that everybody remains at the ready to be able to quickly detect and care for those patients and do contact tracing appropriately.
Thank you. We will go now to